because just the concepts in this book and are so key to what's been going on in our environment, especially post COVID. And I think you do an incredible job of um, introducing that throughout, but really excited to have you on today. And when we look at the panel today, so we are joined by the author, Dr. Geeta Nayyar. So I also hear you go by Dr. G. Is that true, or am I a victim of misinformation? You never know. Okay, so Dr. G it is. So Dr. G is a nationally recognized leader in health tech and is a physician executive, practicing rheumatologist, respected medical executive, and just a relentless advocate for fighting for misinformation and fighting against misinformation in medicine. And this book doesn't just tell a story. I feel like it challenges an industry and it really starts to shed light on how misinformation is not only really eroding trust in healthcare, but literally costing lives. And more importantly, she gives some tactics and strategies of what we can do about it. So I'm really excited to lean into this book. I think there's going to be a lot of complexity in the truths of this book for us to discuss. So I did want to open the floor to Dr. G herself to explore and tell us what sparked this book. Like, what was the particular experience you had where you were like, I have to get this information out to the world?
Well, first of all, Megan, thanks for the intro. Thanks so much for having me. I am having a bad hair day, so you just have to let me play with my hair. Not all of us can have the cool hair that Janae has. But I didn't want to not.
I've never seen you have a bad hair day.
Thanks, Reese. Good to see you all. Listen, the long and short of it for this book is I feel like it's been a long time coming for me as both a physician as well as someone in tech. And really what inspired me, I was actually in this office. I was in my newly created home office during COVID, and it was March 2020. And I remember the moment. I remember just being stuck, being unsure what to do, talking to my medical students and my residents, and just trying to inspire them to meet the moment. And it was very deja vu for me because it felt exactly like I felt as a young doctor during the HIV/AIDS crisis when I was in Washington, D.C. in my training. And it was a similar narrative that we told all of our young docs, which is this is a once in a lifetime public health crisis. You're going to be better doctors for having lived through this. This is unique, right? This is an unprecedented. I mean, all the words we've all heard. And I was like, yeah, I mean, I remember I just heard that. Like it feels like a beat ago, right? In my 20s. And so I really felt inspired to write the book because I feel like this is the elephant in the room for everyone in healthcare, everyone who sees patients, everyone who talks to their friends and neighbors, everyone who has been on TikTok. This is really the elephant in the room, which is that we have always understood mis and disinformation is part of the wallpaper in which we take care of patients, part of the wallpaper in which we discuss healthcare, but it's never been something that we really took as front and center. And I describe it as kind of a beige, boring wallpaper when I was a younger doc to now this neon pink, glaring stakeholder in the room that we really in healthcare have to start addressing in order to prevent it from turning even brighter and even bolder.
I love that answer. Oh my goodness. And it really is such an important time. I mean, more people were online during COVID than potentially ever before for longer time periods as well. So just seeing that rampant misinformation kind of come full circle where we're turning into an attention economy even. So a lot of those misinformative stories are attention grabbing and create fear, and those types of stories do spread like wildfire. I'm curious, how did you try to approach some of the sensitivity around what people really believe as true as far as some misinformation out there, because those stories really do ignite a lot of emotions in people and people start to believe them as truth. Did you approach this book any differently because of any sensitivities that might exist because of the misinformation out there?
I think a couple of things, Megan. So one, I want to just straight out the gate say this is not a COVID issue, right? It just became very apparent and dramatized, I think, during COVID because of the nature of the pandemic. But this is It has been around since the Black Plague, since HIV, since diabetes, since hypertension. This is not a new issue. It has just become magnanimous in a post-pandemic world where everyone did go online. Everyone continues to go to online and turn to social media, compounded with now artificial intelligence making these half-truths that much more faster, better, and efficient to spread. And so that one, I want to recognize that. Two, I have a new version of the book coming out this fall. So we are going to bring it up to date with all of the dramatic changes that have happened. And that is simply where we're at, right? Mis and disinformation are traveling 4-6 times faster than the facts. And largely because in healthcare, we've left it wide open. It's just not been an issue that we tackled. And when you look at the propagators of mis and disinformation, they're just making such a profit, right? They are profiting off of this fear mongering. They are profiting off of the absence of good science being out there and articulated well. And that's really the biggest motivator for these folks, whether there is a political incentive, a monetary incentive, a sort of following or a prowess that is gained. Those are the big things. As far as how I approach it, look, it's about facts. I mean, I'm a physician, so it's going to be about the data. This continues to be for me a nonpartisan issue. This is simply facts versus fiction, right? And when we look at the entertainers out there, we can see really clearly they have $250 million in upwards contracts with Spotify. They are not accountable for what they say. They have no medical license. They have no liability that they carry. This is just simply the world of entertainment versus healthcare experts have licenses that they can lose, liability that they take on, professional credentialing and reputation that can be lost. And in fact, they are not, for the most part, profiting off of any of this, right? In fact, they have more to lose than actually to gain by being out there on social, which is why it's a huge part of why we have not seen so many experts out there is they're busy taking care of patients, right? There is actually only time and money to be lost if they are out there doing this kind of work. And so these are the things that the book is asking is like, how do we flip this paradigm and also just educate the consumer that, entertainment, by all means, we all enjoy different entertainment, no harm, no foul. But when it comes to your health and the stakes are so high, how do you actually critically think about the things that you're seeing, watching, and hearing?
Well, and I think it's interesting because in the book, you also talk about how every clinician is in the misinformation business now. And you just discuss that here as well. What types of tools or training do you think need to be in the medical education, pharmacy education world to help doctors really start to engage more effectively with this new reality that we're in? Because it's a really tricky balance because there's a lot of emotion at play here in our patient population.
100%. Well, first an acknowledgement of it, right? First an acknowledgement, an acknowledgement that this is the world you're going into if you are a pharmacist, a doctor, a nurse, and how do you have those conversations at the bedside? I do think this needs to be part of bedside learning. One of the things I've adopted when I see patients is whenever I make a new diagnosis, taking the time to say, these are the places I want you to read. These are, if they're not on this list, I would like for you to avoid any other, resources and or think critically about how you fact check. And there are any number of AI sources also that can help you fact check, right? And so AI can be just as powerful as of a tool in fighting mis and disinformation, but being mindful of that and thinking critically about sources, et cetera. But I think this is so much bigger than the everyday doctor or pharmacist, Megan, right? Ultimately, all the information out there tells us that if a consumer has a physician, they still trust their physician more than anyone else and more than any other source. But the trick is how many people have a physician, right? And so I think in parallel, this is a healthcare delivery issue. This is a healthcare industry issue. And one of the best things we can actually do for mis and disinformation is improve access to care, right? Because the truth is, if you do have a doctor, if you do have a healthcare professional you trust, you're typically running things past them, right? And you're asking them these hard questions. In the absence of that, that is really where, and that is the majority of people. And that is why access to TikTok, access to podcasts is just a lot more accessible than getting an appointment in today's healthcare environment.
I think that's a really important call out that access to resources is incredibly difficult. It's incredibly difficult. And I think when people do reach out to try to establish care and establish trust with a physician, I mean, it can feel like developing that relationship might take a little bit to find the right doctor-patient relationship that might really resonate with people. How do you counsel patients and physicians, and like how do you kind of structure what needs to be taken into account to really find an effective relationship that maybe doesn't have misinformation as a piece of it, but has like the combating of misinformation as also an important piece of the physician patient relationship?
So again, acknowledging the elephant in the room, but two, I think where pharmacists weigh in, where doctors, where nurses, raising this as a problem at the bedside, right? I've done any number of presentations now for providers, provider organizations, life science, med tech companies, payers, and this is an enterprise issue, right? This is an enterprise issue. And so to the extent that docs, nurses, care teams are on the front line saying, I need some tools, enterprise, right? The average mom and pop doc doesn't exist anymore. For the most part, these are medical groups. These are care teams that are part of a big enterprise. And so, one of the use cases in the book is the Cleveland Clinic use case in chapter 8. And it really is an enterprise approach to combating mis and disinformation. And it's a combination of the chief marketing officer working with the chief information officer, working with the CFO, the CIO, and really building out a marketing strategy that is content-based, partnering with YouTube, but making sure the clinicians are on board and making sure that it's not a cost center. And actually, they actually built a telemedicine strategy around their content strategy and ended up making marketing a revenue generator, right? And so how do organizations actually see this combat of mis and disinformation as beneficial to their ROI, right? And as detrimental to their ROI if they ignore it, particularly when we think about value-based care. If you don't know what a mammogram is, and there's an influencer out there selling you a home genetic kit for $9.99 to tell you if you have breast cancer, well, that's cheaper than your copay, right? And you've already subscribed. So this is someone you like, you're inspired by, you identify with. And so this is an enterprise issue. Again, the everyday doctor, there are any number of examples of amazing physician influencers, but that's not how this will be solved. Those are pockets of individuals and excellence. This has to be an enterprise issue, and it has to be a healthcare industry issue, right? Because to date, we're here in 2025 because healthcare has ignored this. Healthcare's got too many fires to put out and has not been able to take the time to see who's starting the fires. And these are the folks starting the fires. And so there is going to be a direct hit to the bottom line. And on the data side, I think this is something we have to study. We have to make that a more clear case. I mean, we're seeing these pockets of measles outbreaks in Texas, right? So what is the morbidity and mortality in those communities where mis and disinformation has contributed to that outbreak? I mean, I think if we do the math, it's going to be very obvious.
That is really interesting. I'm glad you brought up that it comes down to the data and how we look at this, how we address this. I think what's interesting is on the call, it's a lot of healthcare IT folks, healthcare IT leaders. I'm curious from a technology perspective, especially with your technology background, what do you think is a way that we can influence even at the technology level, the technology platforms, to balance the need for free information with balancing with the dangers of viral health myths? What does that start to look like when we look at this group's influence in healthcare technology? What would you
Sure.
counsel us to how do we fold this in?
Sure. Well, again, the longer answer is going to be chapter 8 on the use case of the Cleveland Clinic. But if I had to summarize it for you, is you all are part of the answer and you all need to lead the charge, right? When I speak to groups and I ask how many people are touching or in charge of the consumer experience, the consumer engagement, the patient engagement strategy, any number of hands go up. But when I ask who's in charge of the mis and disinformation strategy, nobody's hand goes up, right? And if you're doing consumer experience, if you're doing patient engagement, if you're in charge of brand loyalty, heck, if you're in charge of building the business of whatever enterprise or stakeholder in healthcare you're in, this is your problem. And so raising that question, understanding how your tech strategy can either help or hinder this issue is critical. And I think at this stage, everything that we're touching is in some way hitting up against this problem. We're just not calling it that, right? We're calling it consumer engagement, we're calling it patient engagement, but we're not acknowledging that part of this is really about how you build trust, how you meet the consumer where they're at when they have a question. How do you compete with said popular podcast or said popular influencer and make sure that your strategy is just as compelling, right? Just as compelling, just as inspiring, and not talking just in scientific terms. We really have to get down to that third grade level, and we do need to be inspiring. And I think we do need to throw glitter on healthcare sometimes and make it something that people want to watch and hear about and read about. Because that's just the reality. We're not here to just talk to doctors and PhDs and pharmacists. We have to start talking to the everyday person, not just amongst ourselves.
I really like what you're talking about there. I think science communication is a big deal in how we connect with patients, and really focusing on how do we inspire that trust in a skill set that is there for you, that's dedicated their life to really supporting patients and their journey. It can be a really tricky balance. But from the audience, what questions are starting to be out there? I want to make sure everyone feels welcome to contribute. And what are y'all thinking out there?
I think there's a lot to this topic. So I wanted to ask like what your experience has been with this topic. Like, has it evolved? Because I feel like I'm hearing a lot more about people talking past each other. Like we're in the era of like fake news, as a topic. Do you feel like we're going the right direction in terms of popular knowledge, or in terms of like public health wise, or not? And you know, you can call people out too. Bad podcasts. That'd be great. Just kidding.
You bet. Well, look, I would tell you that the topic is really a top of mind topic, right? And even to get a call from my publisher saying we want a new version of Dead Wrong this year was not something I anticipated. Was already working on the next book and kind of put that aside to do this one. So I feel excited and disappointed by that all at the same time, if that makes sense, right? Excited because this is my topic, but disappointed that we haven't moved forward. I think we have moved forward in that we are finally addressing this topic and talking about it. I think the next phase is actually collectively as an industry making this a priority, right? When we think about the different imperatives in healthcare, we've always talked about consumer experience. Now we're talking about AI. I think mis and disinformation is getting up there in a way that it just hasn't before, Janae, if that makes sense. I also think it's really interesting because to me, again, this remains a nonpartisan issue. This has always been about health for me. It has always been about healthcare, and it has always been about the data. I have had organizations say we don't want to lead with mis and disinformation. We are more comfortable leading with the word trust and how you build trust and how we've lost trust. So that, to me, again, says we're dancing around the topic, but we are talking about it. But I think the biggest change has been for me, definitely the receptivity of the topic, and just the invitations I'm getting tell me really clearly that we are no longer ignoring the wallpaper, but we are in the phase of trying to understand this issue and get educated on it. And I think that's where we remain at this moment, right? And the next phase, I hope, is, action, analysis, more data, et
Right.
cetera.
I do think a lot of people are more hesitant, or I guess reticent, to discuss this right now because of the political climate, because it's been politicized, and I don't know. I don't always know what to do with that,
Yeah. And again, those are the conversations that I'm having that are like, let's talk about trust, right?
Right.
So I think we're still having the conversation. We're just putting a little bit of a wrapping paper on it. And I think that's okay, right? I think that's okay because we are kind of living in uncertain times and it seems a bit unpredictable. That said, with the concerns over public health leadership, I think it's all the more important that healthcare organizations that are mission-based, that are clearly focused on patient outcomes, rise to the occasion. And in the absence of clear public health communication, I think it's going to be that much more important that folks that are speaking about science become that much more important. And that goes for life science companies, med tech companies, providers, payers. I mean, our outcomes are all driven by science. And if in the absence of having that public health communication, like we've had this pause, I think that it leaves a gap open for all of us to get really loud.
Yeah, the signal to
And
noise
to be
ratio is not the same.
clear, yeah,
What's
and
that?
to be and I want to be really clear on this because it's good for patients, but it's also good for business. Does that make sense? Because again, if we think about pharma and med tech in particular, they have invested in really innovative therapeutics. But if people don't believe in science and think a supplement is the answer for everything, that's not good business. It's not good business. So I also really am focusing on mis and disinformation as it relates to the bottom line. It is not a simple moral imperative. It is just one of those unique situations where doing the right thing and saying the right thing is also good for business. And I think that's really important for healthcare enterprises to understand, right? To understand that this is actually in fact about their business.
So, Dr. G, what I just heard was because organizations are still in the infancy of understanding this as an issue, as far as addressing it and putting resources behind it, what I'm hearing is the recommendation to make a business case to help influence good actions that we want to see in our organizations to help start to create that momentum. Was I hearing you right there? Just want to make sure.
Yeah, 100%. And to even collect like I said, and to start collecting data on it. I mean, the measles outbreaks are a really great example. I mean, what is that doing to the hospitals down there? What is that doing to the pharmaceutical companies that, dispense measles vaccines, and how is that affecting them in those zip codes, right? I mean, again, I think the numbers are going to be obvious, but show me the money. Jerry Maguire said it best, right? Like, show me the money. I think we will find a very clear distinction between the cost of mis and disinformation to our businesses. And then the flip of that, of course, is if we combat it, the generation of revenues.
I know that there are some cost studies about like the impact or potential impacts of a disease outbreak or of a public health crisis. I don't think that's like something people publicly look at. Again, because they're like so academic.
Again, but again, so like the book and the organizations I talk to are primarily businesses, right?
Oh, right. Yeah.
And like I said, I do think the solution to this is an enterprise strategy, right? I think that there's only so much that can be done in pockets of consumers or pockets of docs, but I think this is an enterprise issue, right? And so enterprises certainly will look at those cost analysis and say, gee, I'm losing money here, right? Or I could build money here, very similar to the Cleveland Clinic, and combat mis and disinformation, but generate revenue. So that's where I have primarily invested in it, because I think that's going to be the biggest shift, right?
That makes sense. Invest with the people who have an economic stake in it, you know?
Exactly. And just the biggest footprint to make an impact, right?
Right. So tell me, I want to hear more. Oh, Sharice had a question. So Sharice, do you want to ask the question? Because I was going to pivot to talking about the update.
I know you were, Janae, and I was like, let me just get a quick question in. So we are really living in an influencer economy, and we do all of this we talk about, all these different places comes down to a feeling of trust. Like what we trust is where we'll get our information. So my question to you is, because you're in a couple of places, you're executive, you're clinical, you're a mom, all the things. So is there a way that like clinicians can work with like influencers to get the right information? If you think about it, like right now, how many people are getting their healthcare information off of like TikTok, right? That's
Everyone.
not exactly healthy. You don't know what's over
Or for
there.
those of us who are old, off of Instagram a week later.
So I
Let's
love
be clear.
that question. I love that question. And I'll give you a real life example. So I had the distinct pleasure of being on a panel at South by Southwest with my middle school crush, Lance Bass. I don't know if you guys remember NSYNC. Megan, you're laughing,
I
but
was
you're like,
so jealous of you. I was like, wait a minute.
I'm
I
a
was like,
fan.
is she going to invite him to book club? Because he's always invited.
All
He's
you
got
always
great
invited,
hair.
standing
And he
invite.
never has a
That's
bad
like
hair
a
day.
career moment you had. So
It
we should
really
celebrate
was.
that.
I
Yeah.
mean, I loved NSYNC. I definitely was like throwing back the middle school days and jumping around the house a little. So super jazzed to be with him. And, I asked him the exact same question, Charisse, right? I was like, look, I'm a doc, I'm in the space, I'm talking about mis and disinformation, and Lance Bass is sitting next to me talking about his diabetes. And so I said that to him. I said, what is the right way for celebrities, influencers to work with healthcare experts? And he was like, Dr. G, we're doing it, right? We're doing it right here.
Right.
And I love that answer because that is the right answer, right? The influencers out there, the celebrities out there, they're not bad people. They're absolutely part of the fight. And I think we just have to find the right partnerships that leverage that celebrity, that platform, that authentic story. But, Lance said it really clearly. He's like, guys, if you're watching this, like, ask Dr. G your healthcare questions. I'm here and hopefully to inspire you and make you understand you could be in my shoes, but I'm not up here to tell you what to do about your diabetes. I'm just telling you what my story is and what, worked for me and what didn't. And so I think that the celebrities that are out there, the influencers that are out there that are willing to partner and or the healthcare entities, providers, payers, life science companies that are looking for a partner, that's the right partnership, right? It's finding that inspiration and just that place where science doesn't go. Those are not the places we go, to your point. And we also don't do it well, right? Like, no one's got better dance moves than Lance Bass, right? Like, that's just not our space. And so having the humility, and that's what I mean by putting some glitter on it, right?
So not every doctor has to become part
it.
of a jaunty little boy band, is what I'm hearing.
Yeah,
Although you could.
I feel like Austin Chang could do it. I feel like if there was anyone, it would be Austin.
Right.
I think
Austin.
like when you think about examples, like I'm sure you've heard of the medical mythbuster Joe Burvell. He's amazing.
Yeah,
I think
that's
those
awesome.
kinds of ways, I always say get in where you fit in with social media, if you're working with influencers and that type of thing. If you can actually give the right information with the right person, because I'm like you, like the whole like supplement conversation and the nonsense that some of the stuff I see from these influencers, I'm like, did they even consult anybody about what they're telling people because people trust them? And it's like, I feel like it's being a little irresponsible if you have great influence and you are using it just to push a product, not knowing what you're actually saying.
Listen, that's happening every day. I mean, that's the gig. And that's why mis and disinformation is so profitable, right?
That's the MLM magic.
And that's where we have to also educate people on like, hey, so there's entertainers and then there's healthcare experts, right? But you're always going to have those folks that do that. And that's where I think, especially in this era of AI, it's about critically thinking. It's about, to your point, Megan, as clinicians, also saying to our patients, like, look, there's a lot of stuff out there that seems really compelling. Check the source, right? Ask yourself what they're selling. There are fact-checking AI tools out there as well. Fact check it. Is that the only place where they're saying this one stat is legit, or is it replicated across the board, across that particular disease, that particular therapeutic, et cetera? So I do think in this era of AI and social media, a lot of this is going to fall on the consumer to get smart, right? And it's interesting because I'm a mom and I have a 13-year-old, and it's kind of like stranger danger, right? Like we talk to our kids about stranger danger, but we don't ever seem to talk to them about like social media and how to interact with it. It's the same thing, actually, right? It's the same concept that you wouldn't just believe somebody because you met them on the street and they, opened up a jacket with like 6 supplements in it, right? It's really
Although I want to find that person because some of those supplements are spendy, guys. Those are expensive supplements.
Here's the dupe. Yeah.
For all your expensive vitamin needs, find Dr. G on the street.
Oh my goodness. It's funny whenever anyone asks me about vitamin C supplements, I'm like, at least for me, I live in South Florida. I'm like, buy an orange. It's like 50 cents. You get like a whole bag for like $2.
That's the
You're like, I have
conversation
this
we
thing called
always
fruit.
have with our family, like some of the relatives, because they always wanted like supplements and talk about supplements. And I have physician at home, and we always say if we are eating like well, we don't need any supplement until and unless it's like we have some deficiency or some issues. And they give us like that face, like as if we are like trying to save the money by not spending on vitamins or things like that.
Yeah, that's the flip side. And I don't mean to say that all supplements are bad. That's not the case, right? That's
Yeah,
certainly not the case.
that's
But
not the case, but it's like, do you really need the supplements, or like are you like just having it because some
But those are their
people are
emotional
talking
support
about it and people
supplements,
are
you know?
consuming it, so it's like you are just like, it feels like it's like kind of peer pressure or something like that, because
When
everyone
you
around
start,
are
if you think
using
about
it,
young
so they
women,
feel like they have to use it.
they definitely, the younger women seem to really like, oh, she's saying I should take this type of supplement, so I'm going to take that too.
Hmm.
You know,
And it's
it,
interesting. It's not even just supplements. It's, I have to say the whole cosmetic space. I mean,
Cosmetics, yeah.
cosmetic space, as you
It's
said,
the
young
same thing.
women. I mean, I have banned, I'm gonna say it, Janae. I have banned Sephora from my daughter and her friend group. I have told the moms, no gift cards, no trips to, like, we don't, listen, everybody needs moisturizer and sunscreen. That's it.
Yeah, understood.
That's it.
And you've saved yourself $100,000. I think
I
that's
did, right? Well,
I had
and
I had
everyone's
this conversation
the
with my
moms
cousin
were
once,
the
like
moms were very like, thank you, Dr. I'm like, I will do, this is my intervention. We are going to do a living room dermatology 101 for everyone.
so important. I do think that's something that's really important. And I've always thought about this, even in terms of healthcare and mental health. Like, healthcare doesn't do a great job of looking at those, like the needs that the consumer products are meeting. Like, they're not really thinking about like how nice it is to be part of a group. How if you see something online, you might trust it just as much.
That's
Like,
right.
psychologically, we're designed to trust
Yeah.
humans and to
That's
judge
right.
between who's
Create
trustworthy and who
community.
isn't, you know?
Well,
So like,
totally. And our community, right? Like, well, if
right.
Janae uses it, it must be great, right?
What? My kids
Look at her
don't even
hair.
like my kids don't even like makeup.
I
They're not
just
into
asked
it.
her about
Look,
her
I'm like,
lipstick.
I'm here bringing my kids to Sephora. I'm like, do you want any of this? And they're like, absolutely not, Mom. That would have wasted money. Like, go buy us like a book. And I'm like, okay, well, that's great. Like,
Janae, I'm
my
sending
kids
Sonia
don't
over.
like makeup. It's fine. It's fine. Like, I've come to peace with it. I'm glad we could do therapy together. But like, but like, I understand it. I
I'm
like
lucky
it.
in that
I like
terms
things
as
that make
well.
you feel special. Like, I've worked with people who work in aesthetics and plastic surgery. And like, I think there's a value in a lot of these things that misinformation is tapped into. And like,
100%.
I'm sorry, like, have you been to a doctor's office? Not all of them look great and shiny. Like, some of us want that, you know? Like, we don't want our stuff from like the most disgusting room with like those ceilings that you could, and
No,
fluorescent lighting.
it's
Like,
fair. That's
so how
100%
do we find? I
fair.
mean, you're literally in Florida. You have like the most beautiful people. Aren't you in Miami? Like, the most plastic surgery. Like, you guys are in it. So I get like toning it down a little in Miami, but like, but
Well, look, we always tell our kids that the cover, right? Don't judge a book by its cover, but the reality is we all judge a book by its cover, and not just in healthcare and everything that we do. And so
Everything.
I think that's part of it. But you're raising a more interesting question, which is, one of the number one things you can do, I think, to combat mis and disinformation is to improve access to clinicians. Right. So we're living in a time of physician burnout. We're living in a time of physician shortages. And that goes for the whole care team, pharmacists, nurses. When I say physician, I mean the entire care team. Right. And so that is actually one of the best ways to combat mis and disinformation, because the data also tells us that the one person they still trust, that consumers still trust when it comes to their healthcare, is their own physician, 93% of the time. The catch, though, is if they have a physician. So in other words, I'm just going to use my patients, right? Like if Dr. G, my patients say all the time, if Dr. G, you say it, I'm going to do it. You don't recommend it, I'm not going to do it, right? But they have to have gotten to me, had an appointment with me, built a relationship to me, right? There's this huge barrier. But if they've done that, for the most part, me and them are on the same page, right? And so that is one of the best things we can do to combat mis and disinformation, is to improve access. And with telemedicine, I think that's the other thing enterprises can do, right? Doubling down on telemedicine, figuring out hybrid care in a way that helps open up the floodgates is really key, because right now, depending where you are in the country, you can't get a primary care appointment for 6 to 9 months,
yeah,
right? And
if you want a
so,
new doctor, good luck. See you never.
right. And so, but TikTok's right there, right? Instagram is right there. Your neighbor's right there. And so, and actually, Megan, for you, I mean, in the pharmacy space, I think we have underappreciated the role of pharmacists, because actually so much of what pharmacists are able to do are to be that accessible resource, to also be that person that's in the community, in the zip code of the patients, of the consumers. I think pharmacists have played a tremendously underrepresented role in helping to bridge that trust between consumers and what is recommended by their doc.
Well, and Dr. G, I'm glad you brought that up. I think it's interesting to look at the most accessible healthcare provider is a pharmacist, and that's not a replacement for your doctor, but it's an incredible additional resource, especially noting the gaps that exist. And so people don't know you can go ask your pharmacist questions in store, in hospital, on the phone. Like, it's really incredibly accessible, the questions you can ask a pharmacist. They are trained in self-care. The products that have a lot of misinformation are often available right over the counter. You have assistance and support to kind of navigate that intensive brand world of all of the claims that may or may not be true. And pharmacists are trained to help kind of direct someone to what products you need, what is a necessity, what is this, like what really is harming you versus helping you based off of your specific skin type or body makeup. And pharmacists are also getting into genomics, and that plays a big role into what nutrition you should have on board, supplements, medications you should have. I mean, it's a big deal. And I think a lot of patients, like you were talking about, may not realize the questions to ask. So I always counsel people to just call up your pharmacist and say, what questions should I have right now? Like, what vitamin deficiency risks might I run by taking this medication? Might not be a question anyone knows to ask. But if you just kind of keep it open-ended, I think you could get a lot of help and support.
Yeah, I love that access. And also, a lot of what you're saying reminds me of, first of all, that Megan's amazing. And I text her when I have questions a lot of the time. She's a big fan of honey. Secondly, because my kids have allergies. Secondly, it reminds me of some of the work that Jay Bott and Deloitte have done, their Health Equity Institute, talking about that business case. They've said for equity, or the business case for making the right decisions for individuals. And when they talk about that too, they talk about where you trust. And pharmacists are really trusted, and physician trust is decreasing right now, and leadership trust is even worse, right? Does your book talk about that at all? Like,
Yeah,
share with the class, guys.
100%. 100%. If there is one chapter you read in the book, chapter 8 is really that chapter.
I mean, I've read it. I just thought I'm loading it up for you. Tell us more.
Thanks, Janae. And again, look for the new one in the fall. So I'm really jazzed about that as well.
Yeah. So, do physicians talk about that a lot? Like the trust and misinformation?
Yeah, absolutely. Absolutely. And I have to tell you, one of the casualties, I think, of all of this have been physicians, doctors, nurses, pharmacists, everyone. It's this demonization. And, when I talk to hospital boards and CEOs, I say, these influencers, they are effectively, if it was in brick and mortar, standing in your ER saying, hey, don't trust these people behind me. Take my supplement, take my genetic kit, whatever hack it is that they're selling. And I say to them, you would never allow that to happen in a brick and mortar hospital, right? That person would be escorted out by security in less than 60 seconds. And yet we allow this to happen in the social media space. And it really has undermined the trust of healthcare professionals. And I think that's one of the contributors to burnout. We know is this demonization of healthcare professionals. And that continues, right? It's really how the book starts, right? I talk about my patient Jerome, who has AIDS, who I repeatedly have to discuss the diagnosis with, and he just keeps telling me that I'm wrong. I don't know what I'm talking about. I'm clearly a young doctor who knows nothing because he's not a homosexual and he can't have AIDS. And I took care of that man until he died, and he just kept telling me how incompetent I was. And that does not do anything for morale. That does not do anything for inspiring you in the field you've gone into. And so, I mean, Janae, this is your space, but it is one of the contributors to burnout is all of the humanization of healthcare workers.
Right. And I think a lot of people
I remember crying on that part of the book.
Yeah.
I cried.
Yeah, it was pretty emotional. I mean, I remember it to this day. I mean, I remember
Yeah,
it
yeah.
to this day. And
Yeah,
it
like
was one of my very first patients to ever die. And it was, you don't forget
mm,
that. And
no,
for that whole experience to be told along the way how terrible I was as a doc, I mean, it was crushing. And I was a young 20 something. It was crushing, soul crushing, really, in many
right.
ways.
Yeah, that chapter took me back to the like when I was young,
Yeah.
when the
Mhm.
misinformation about the HIV AIDS was so much that in back home too, like they have to approach with the mass media and they make like teleserial regarding like the misinformation that is like taking the society or community. And I remember all of those stuffs
Yeah.
with
I
that
mean, the good
chapter.
news is if we look at AIDS and HIV and what has happened, first in the medical innovation space, right? It's become a chronic disease, much like breast cancer versus a death sentence. But two, if we look at, and the book does cover this, the work done on mis and disinformation and AIDS it has worked, right? It has taken an entire generation, if not more, but it has taken a really, once it was made an intentional battle against mis and disinformation, we've gotten to a place where there's a lot more general knowledge on HIV than there ever was, right? But it takes a long time. That's one of the things as well, is that kind of once I'm going to say a rumor, right? It's almost like fighting rumors. Once a
Mhm.
rumor's out there, it's just really hard to get it out of the back of
Yeah,
someone's psyche of
yeah.
like, there was this thing and I heard it. And so it is a really intentional battle. And we have won it in many different spaces in healthcare and medicine. And I do think HIV/AIDS is one of them.
Mhm.
So there is an optimistic future ahead of us, I believe. And I think one of the things I'd love to leave your audience with, Janae and team, is that, right? Is to really say, this is one of the most exciting times to be in healthcare, to be a healthcare consumer, to be anyone that's a healthcare leader. One, as a consumer, you have more tools, more information sources, more technology, more people even just discussing healthcare and wanting to be healthy than we've ever had before, largely because of the pandemic, right? We got stuff like these that can help you measure, understand everything about your body, whether it's a watch, a ring, maybe it's earrings
Oh my
tomorrow. I don't know.
gosh,
I
yeah.
hope it's something really blingy.
Glasses.
Yeah,
Um,
right? More
or
sparkles.
bracelets, right? Some more sparkles. I'm down for the
You hear
glitter.
me, Garmin? We
Um,
need more sparkles.
and then secondly, on the healthcare leadership side, I mean, we've never had more tools. We've never had, AI go this mainstream. We've never had a consumer that even wanted to know how many steps they had, right? We
Mhm.
also have some lessons learned, right? Social media has taught us a lot. We actually have data on social media now, right? Showing us the good, the bad, and the ugly. Same with EHRs that were largely the biggest innovation that have happened to date. We've learned a lot. And those same
Mhm.
lessons, while they might be different technologies, those same lessons apply. And so as we're all trying to figure out what AI means, what AI will mean to our organization, I don't think you have to look that far at
Mhm.
some of the things that need to be done and some of the things that need to be avoided.
I love that. I love that optimistic view. I think that's so important. Also, I feel like I should admit, guys, that I have purchased supplements and I have fallen. I
Again,
have
all
Oh,
supplements
That's
are
go
getting
healthy.
I
ahead.
have
bad.
at one
Oh
point in
Yes.
my life
my God.
joined an MLN supplement thing and I
That's
was drinking
not
the
what I
Kool-Aid.
said.
No, it wasn't. It was not topic like on a separate topic. Like I get it too. Like part of me really gets it and I feel like that's something that I wanted to talk about a little bit with you to close because I know we're about out of time like I remember my youngest has allergies and I didn't know what all of them were. And let me tell you, that Reddit rabbit hole in the middle of the night when you don't know why your kid has a rash, that's like
It's
a
legit.
really good place.
It's
That's a
legit.
place where you go. And I get it, how people will just, I would have believed anything. I would have tried lots of stuff. And what is healthcare doing or what's your opinion on that? What's the best way for us to take on that need or for us to make things available that make sense, you know?
So if you had a provider, right, that would be the first thing is to
I
have
did,
that.
but I'm not going to ask them the crazy questions always. Sorry.
I would say you should.
Well, I was about to say that's
I
half the
would.
problem.
I would. I would schedule a
Hmm.
telemedicine visit, even if it's just to ask all of your questions, right? So
Right.
I think one, don't discount it. We've heard it all as docs, and that's what your doc is there for. And even if it's scheduling literally an appointment for counseling, I would do it. But two, and I get asked this all the time, right? If I had a blog, if my enterprise had a place where I could say these are the top 5 things Dr. G recommends for lupus, these are the top 10 things I recommend for rheumatoid arthritis. I think that's how we do it, Janae, right? Is that if at the enterprise level we have Reddit has, you would go there. I believe you would go there, right?
I would. They had that for breastfeeding. There's like a famous breastfeeding doctor who was like on Reddit.
Yeah, I mean, Cleveland Clinic, this was a big part of their success that I discussed in chapter 8. They've got this huge content library, but here's what they have. Also, it's read all this stuff and then click here to make an appointment.
Access.
Yeah.
Right. So it's
I
access,
think
but it's
Mayo
also
Clinic has the same
accountability.
thing.
It's also accountability. It's I put this out there, ask me your questions, right?
Yeah.
Whereas on Reddit, you've gone down this hole. Who are you gonna ask? Who are you gonna ask
Right.
how it turned out? Did that work? Did that not work? What was the side effect? Cleveland Clinic put it out there, but also said, hey, talk to us about this. Like, leave this, but we're also here and we're accountable and we're accessible. And so I think that's how we do it. That's how I think we do it.
Yeah, I like that. And you really personify that. Like you're perfect. You're pro telemedicine, you're pro digital health.
I definitely don't think I'm perfect, but I think it's the reality.
Okay, well, I said it and I don't take it back.
I think it's the reality, and I think it's and because I've studied this, right? And because I've studied this and I've examined it, and these are the things that work.
Yeah.
So, Dr. G, you dedicated this book to your parents, which touched me because my dad was the person who told me, always ask your doctor, always believe your doctor, all that kind of thing. Like, I find myself turning into my parents because of the things my dad taught me about healthcare, that type of thing. So when you look at it, what your parents taught you, what do you think they would think about what's going on? Or have you, I don't know if your parents are still with us, have you talked about the disinformation that's out there? And,
Yeah, 100%. So, thank you for that. I really appreciate that question. I actually just took my parents to, there was an event I spoke at in about an hour from them. And so I invited them. My parents are actually perhaps the only doctors trying to stay in medicine. So they both still practice. And so I said, why don't you come get your CME and you can what it is I do, because I don't know that they know what I really do. And I just posted it on LinkedIn. You should check it out. It was really special. I mean, I have to tell you, it's really special. And it was an event with hospital CEOs and boards. It was that event I was talking about. And so they both, no, I think they were really, I think for them, having mom is now late 70s, dad is early 80s, for them, they've seen it all in medicine. And I think the message really resonates with them. They've also practiced in both, in India, the United States, and the UK. So they really have also a global perspective and an understanding that this is real and very evolved. So I think it did align with them. And I think it aligns with most physicians, right? Like, I think it aligns with most physicians. And they also, feel confused about AI. I would say that they're like, we don't know what the heck is coming, good or bad. So which I think is a sentiment we all also feel on some level.
Yeah, I can relate to that on a deep and spiritual level.
And just one last thing, Dr. G, can you let this group know that I am your favorite reader?
Oh, absolutely. Therese is my favorite reader. She has been from the beginning. I don't know if you guys know this. I was in Vegas. I cannot remember. I don't know if it was HIMSS. I feel like everything is in Vegas every 6 weeks. I feel like I'm in Vegas, but I was running to a flight in my I just got off stage. I was in my heels. I didn't have time to change yet. And I was literally struggling. I had like 2 suitcases. I could not get my suitcase in the Uber. And I don't know, 10 guys passed me and nobody stopped.
Nobody helped her.
To help a gal out. And Sharice, out of nowhere, Sharice comes in and grabs my suitcase, throws it in the back. She's like, what else you got? So Sharice is my favorite reader, but also
I was like, don't worry about it. We got it.
My favorite girl. She just came in and I was like, Sharice, I gotta go. I want to thank you, but I gotta go. I got 5 minutes or I'm gonna miss my plane. And she just bailed me out. So talk about women supporting women. Sharice is by far the embodiment of that, because I didn't even see you. You just came out and I'm like, oh my God, how'd you do
I saw you struggling and I just remember why aren't any of these guys help? And it was funny. The reason why I really noticed you, there was an Asian gentleman behind you hitting a woman. And I was trying to get the attention of someone. I'm not kidding. And I was trying to get the attention of one of the attendants. I'm like, why are all these men around not helping anybody?
Yeah, Sharice is everyone's favorite. I didn't know that story. I love that story.
No, it was a total Shiro moment.
It really happened, yeah.
It really was very sweet.
That was
So
a strange, I think it was him because I just remember feeling like, why is nobody helping?
Oh my
yeah,
gosh.
that's exactly right. So thank you, Cherise. Thank you
Mhm.
for
I love that story.
Cherise, you're a hero. You're a hero.
It's funny. I was just excited that she was signing my book.
You guys are all heroes to us all. Let's be honest. Let's be honest.
Well, listen, thank you for doing this. I hope I can come back, Janae, when the new book
Yes,
is
we
out.
need the
Yeah.
update. We're going to need the update, and everyone's going to
Yeah.
read it and love it.
Thank you. I appreciate it. I appreciate it. And thank you for everything you ladies do in the industry. And I'm thrilled to see you all growing, Sharp Index growing, Joy and the team, hit like a girl. I mean, I love it all. I love everything you guys have done. And I'm thrilled to be supportive and helpful in any way that I can.
And
Thank you.
Dr. G, thank you. This has been really, really inspiring and helping us really break down like how do we address misinformation? What does misinformation look like? How do we create an action plan to mobilize an effort to really make a change? And I think everyone's walking away today a little bit braver, a little bit louder, a little bit more committed to create and foster that trust with our patients. Just really thank you, Dr. G. You're absolutely wonderful. Really powerful message. Thank you for coming and talking with us.
Thank you, everybody. Have a wonderful